the Department of Health has embarked on a very aspirational goal. All for health towards health for all. This is the gist of the Philippine Health Agenda. There are three guarantees in this agenda. One, that we are able to provide services for the life course, that's life stages from womb to death, quality of death. And for addressing the triple burden of diseases that includes cancer. The second guarantee is that we're able to provide this through a service delivery network, just like the networks described earlier for Medical City. And lastly, universal health insurance. Those are the three guarantees. What you have presented here today gives us more inspiration because we are going to change the landscape. If it's not little by little, small steps or big steps, we want to do it differently, not because we had some failures in the past or because we have some unfinished business, because Filipinos deserve them. What do I mean? We're exploring ways how to provide services just like you do. Okay. Earlier, for those who were early enough to attend the symposium, there were advances in screening for colorectal cancer. We are amazed how robotic surgery and enhanced recovery after surgery can change the outcomes for patients having these conditions. And we also heard about what we can do only at that point that patients become partners in healthcare. And the testimony of our very own architect here reminds us that God is also a healer, as what he has experienced. Now, what changes should you expect? For many years now, all of us, when we say we're going to provide services, it's only up to that point that we have the people, we have the resources, we have the infrastructure, we have the equipment. That means it's better health care. But that's not what's needed in the country. It's better health. Now, when it's better health, it's not about providing the services, but actually making arrangements so that services are offered. Services that are needed that can be accessed by Filipinos. Look at Medical City. You make arrangements for patients that they will be cured, that they will have a good experience at your hospital. So you move from individual practice to team practice. It's a multidisciplinary approach. And then you mushroom into different networks in a satellite kind of network so that access will be improved to the same services, the same quality, the same standards. You are a leader in this respect. But the Department of Health has a big burden on her shoulders. We should be the leader for all Filipinos. To scale up what you have accomplished, making arrangements means to us and to you that you will be part of our service delivery network. How about that? Earlier, during my conversations with your staff at the lobby while we were waiting to open the exhibit, I was amazed how you get into wider lengths of educating your patients. And there was his testimony that he received information. And we have been doing that all these years. But tell me, sometimes all the best information that come from us fall on deaf ears. Exactly, this was the reason why we looked again at data presented to us, what is really happening in the health sector while people refuse to be healthy. And you know what we found out? It's health literacy. Isipin niyo po, even if you craft the messages in plain language, if the recipient of that message has low health literacy, they will remain clueless. It's good that Mr. Guerrero is able